Hello, my name is Fran Robertson. I am Clinical Director with the Center for Children and Families in Norman, Oklahoma. This agency is a 40-year-old nonprofit agency that is supported by United Way, by many grants and contracts, and by private funders. In our agency, we believe that every boy and girl deserves to grow up safe, nurtured, and loved. And because of that, we offer services that include healing child abuse and neglect, work with foster and adoptive children to help them return to their developmental path after having early childhood trauma. We also support and educate many kinds of parents. We deal with parents in severe divorce conflicts. We serve very young teen parents. We serve brand new parents who are working to bring up their new babies. And we serve parents who've been involved in the child welfare system because of abuse and neglect issues in their families. Today, we are looking at child abuse and neglect in Oklahoma, what you really need to know. We are looking primarily in this first part at prevalence issues of child abuse and neglect, at categories and definitions of abuse. As educators, you are very familiar with children in your classrooms, children who you know have distress, children who you know have problems at home. Some of those may not be abuse and neglect issues, but some of them may. And when we look across the United States, we learn that every 10 seconds a child is reported abused or neglected. In Oklahoma, in 2008, 11,714 children were confirmed to have been victims of abuse or neglect in our state alone. Now that means that there were many, many more reports made than were actually confirmed by our state authorities. 65,000 plus reports of suspected abuse and neglect were made in 2008. As you will learn in Part 3 of this series, we all are mandated reporters if we have any suspicion of abuse or neglect. The State Department of Human Services is the state body, and their Child Welfare Division is the arm of that organization that is responsible for assessing and investigating reports of child abuse and neglect. That's their job. 11,714 were confirmed by our Child Welfare Division. Even one child suffering from the experience of abuse and neglect in Oklahoma is one too many. Let's look for a moment at the categories of maltreatment and those definitions. I've chosen today to look at neglect first. We include neglect, physical and emotional abuse, and sexual abuse as the categories. But as we look at neglect today, the definition is the failure to provide for a child's basic needs. The reason I wanted to start here is because in Oklahoma, 84% of those 11,714 confirmed cases were cases of some kind of neglect. A child who experiences neglect may be withdrawn and clingy. They may be hypervigilant and very spaced out. They may be defiant or overly compliant. You see this in your classrooms. Or those needy children are the ones who are resistant to contact when you put your hand on their shoulder. The experience of childhood neglect or abuse, either one, demands that a child develop some survival skills. What we know is that these survival skills don't work well in the school setting, but they're absolutely necessary for their living in a high-risk environment in their home. It's important to note that the experience of neglect, as I stated earlier, is far outnumbers the experiences of abuse and even of sexual abuse for our kiddos. One of the primary contributors in our state is the substance abuse by a caregiver. And I think we're all aware that substance abuse is a huge issue in our state, but it is a huge contributor to abuse and neglect, because when those folks are identified and brought in by the police, There are often children who've been there with those families. There are other kinds of neglect, and this is a list of some of those that you'll see. Things like the threat of harm, someone threatening a child, the lack of ability to protect a child from dangerous adults, from other dangerous situations. All of those kinds of things are failure to protect. Exposing a child to domestic violence is considered neglect. Not being able to provide adequate shelter or supervision or physical care are all other kinds of neglect. We sometimes see a failure to provide for nutrition, abandonment. Sometimes we see a failure to obtain medical attention. And we know that there are many contributors to just those issues of a parent being unable to provide. Sometimes the services aren't available. Sometimes the parents don't recognize the need. And sometimes there are other barriers that get in the way. Let's look a moment at physical abuse, which accounts for about 12% of the abuse and neglect in Oklahoma in 2008. It's defined here as inflicting a non-accidental physical injury on a child. I think that when we think of that physical injuries, we think in terms of things like a child being kicked or shaken. We sometimes think of a child being bitten or burned. Those are very difficult things to think about happening to a child. Emotional abuse is a pattern of behavior that impairs a child's emotional development or sense of worth. Emotional abuse most often occurs in the context of other kinds of maltreatment. It is quite difficult to make a case for emotional abuse unless it is so severe that it becomes the primary maltreatment. That might include something like severe public shaming or a patterned, repetitive effort on the part of an adult to destroy a child's selfhood. And that does happen. But most often emotional abuse happens in the context of other abuses. Sexual abuse, which is the abuse that most often we see in the media, actually accounts for 4% of the abuse and neglect in the state of Oklahoma in 2008. And that can include things like exposure to pornography, to exposure to adult sexual activity, fondling, intercourse, and other intrusive sexual behaviors. This often occurs or can occur with long-term grooming of a child so that the child is cooperative to some degree, or it can be episodic and violence and coercive based. Survivors of child abuse and neglect are at greater risk of all kinds of problems in later life, as is noted here. One example is that over 60% of our very young teen parents often have a history of some kind of abuse in their earlier childhood. You know, one of the reasons that we focus so much on educators knowing is because these children are all of our children, and the effect is not only on the child but on the whole society and on our schools. Many of you may have heard about the Adverse Childhood Experiences Study, that research that was done by the Center for Disease Control and California's Department of Preventive Medicine, along with Kaiser Permanente. This was prompted in the early 1980s by Dr. Felidi's observation of work with some of his obese patients. And I'm not going to go into a full explanation of this study, but one of the things that the outcomes of this is that they connected early childhood experiences with adult health outcomes. And the study is a very powerful one. They first began to identify 10 experiences that children have that negatively affect their adult outcomes. And these are the experiences. The 5 on the left side of your screen are maltreatment experiences in childhood. The 5 on the right of your screen are household dysfunctional experiences of childhood. What we know is that if an individual had as many as 4 or more of these adverse childhood experiences in their youth, that they are then at greater risk for adult risk behaviors that then may lead to common causes of death and disability. Now, I want to point out on this slide that there's not necessarily a line between the column on the left and the column on the right. It is not necessarily a direct link. However, what the Adverse Childhood Experiences Study would say is that if you have 4 or more of the maltreatment experiences as neglect, especially as in neglect, physical abuse, sexual abuse, and you have some of the family dysfunctional experiences like an incarcerated parent or divorce, and you have 4 or more of those, you are at much greater risk of having taking on risky behaviors like alcohol and drug use, smoking, having multiple sex partners, living with severe obesity. All of those things have a tendency to lead toward heart disease and cancer and stroke and diabetes and mental illness, all of which can cause early death and disability or disability. I encourage you, if you're interested in this study, to look at the website at the Oklahoma Institute for Child Advocacy and read more about this study, because it definitely connects what many of us have intuitively known for years, that early childhood experiences affect our health as adults. Now let's move on to look a little bit. This is a graphic that shows the confirmed cases of neglect over and above the physical and emotional abuse and sexual abuse. So you see the tall column there represents neglect in the state of Oklahoma in 2008. And when we talk about the ages of children that are most affected in the state, looking at all of the confirmed child abuse and neglect, we see that the highest risk group are those children between 3 and 6 years old. But when you look at this chart, you'll also see that there's no age that's not affected, but 3 to 6 years old is the highest affected. When we talk about child abuse and neglect, we also have to talk about deaths, child deaths. And it's a reality that's painful. In 2007, 39 children died as a result of abuse and neglect. And in 2006, 32 children died in our state. When we look at the ages of those deaths, what we see is that close to half of the 39 deaths in 2007 were children under 1 year of age, and 27 of those were under 2 years of age. This tells us that the youngest are the most vulnerable, and helps us understand why when the Department of Human Services Child Welfare investigates, they will often put these young children as the highest priority because they are the most vulnerable and the most helpless. These are difficult statistics to review, and the reality of children and families who live with this kind of harm and pain is really a challenge for our wish for all of our children. As a part of their lives, though, and as educators and as community members, our duty is to begin to learn how to recognize the signs and symptoms and to make those reports. In Part 2, we're going to look at the signs and symptoms of abuse and neglect, and in Part 3, we'll talk more about the reporting questions. This is the number that is listed here to call if you need to make a report. This is a 1-800 number. And you can also call to make a report to your local child welfare office in your county. This information, some of this information has been provided from the statistical information on these websites. And I encourage you, if you want to look at this or see updated information, these are resources for you also. I'm also a resource for you. If you choose to do so, you may reach me at the Center for Children and Families. Thank you.